Hi, welcome to North of 48. It is February the 16th. It's our second live stream. If you go into the channel and look at our earlier broadcast with Phil Eitner out of Ukraine, I think everybody would be quite happy. It was a thoughtful and provocative interview. As far as the United States goes right now, Joe Biden is still president. Don't flag me for electioneering. I'm just pointing things out. One of the worst things that happened in America was a pair of juveniles were charged. That's not the worst thing, is because they had a mass shooting at Kansas City Super Bowl parade. And if anybody's seen that, it was just dreadful. They were charged with crimes connected to the mass shooting, and a news release from Jackson County Family Court said the juveniles were charged Thursday on gun-related and resisting arrest charges. No further information was released. Their defendants are age 17 and under in Missouri, are typically go through the juvenile system. And the federal law prohibits the death penalty for anyone under 18 at the time of the crime. Initially, there were 3 juveniles, but one was released when they determined that person was not involved in the shooting. The one thing, much like Canada, I have to say that I thought for sure these 2 juveniles would be killed. If I can say that. In Canada, you probably had a chance to be alive, but it's just something. 22 people were injured, more than half of them children. And I have no idea what the United States is going to do in the future, much like everybody else in the United States. On another news, dogs are running wild in Georgia, but that should be South Florida. So that's my bad on the typo there. It should be South Florida. And we brought a guest on to talk about that. And if I may bring Davey on. Hey, Dave.
Hey, how are you?
Oh, not bad. So, well, thank you very much for asking. We have weather above zero for a change, so that's kind of neat. I was up north and it was minus 31, but it's supposed to be minus 51, so there's still global warming happening up there, right? So,
yeah,
could not tell me any different. I tell you,
yeah.
it was cold, man. But I was up
I
there
have
at
a
minus
friend up in
41 too.
Iqaluit right now. It looks cold.
Oh, I have a cousin up there, a geologist. Yes.
Ah.
So what we do to pay our mortgage, Dave, that's what I have to say, you know. So Dave, you just had a, and we have a person from Florida in the audience. You had a trip to Florida. You brought the kids and stuff, which was
Yeah.
great. That must have been nice, especially this time of year.
It was
And,
warm. Yeah.
and you had mentioned that you hadn't seen so many dogs running around.
Yeah. Well, while I was driving through Georgia, I was staying just south of Orlando,
Mm-hmm.
and fantastic there. Everything looks like like if a cop sees garbage on the streets there, they shoot the garbage and it's dealt with, right? Uh, like actual garbage. I'm not like using that as an inference for people, like just
Right.
act like physical actual garbage.
That's right. Yes.
Yeah, like a Dutch person. But no,
Apologies to the Dutch.
apologies to the Dutch.
We saved you once and we will again, so don't worry about it.
All the time. Love the tulips.
Love the Dutch.
But driving through Georgia, dogs all over the side of the highway. I don't know what it's about. I don't know if these are like COVID dogs that are finally getting ditched in Georgia all these years later. But yeah, it reminded me of being in Latin America.
That is something else right there. The pets, the pet compounds or storage compounds are getting overwrought with people who have given back their animals from COVID because they figure COVID's over and they got no. It's a disgrace. Actually, the way the shelters are getting.
Yeah, and I don't blame these people either. A lot of people were extremely isolated during COVID and adopted pets um, into their homes.
Hmm. Hmm.
In some cases, people had like extra money because they weren't going out and stuff anymore,
Right.
or some in some
Paying
countries like
fuel to go
ours
to
in
work.
Canada, like
Yeah.
we had a decent COVID benefit coming through, which actually
Helped.
saw a lot of people making more money than they
Hmm.
had before.
Right.
So we're able to afford a pet, and after COVID, we're able to afford a pet. So I don't think a lot of these people are like giving up their pets because they're horrible bad people, but like they don't have time to take care of them anymore, or they
Mm.
can't afford them. But yeah, the state of the shelters and stuff, it's horrible, like
Well,
you were
maybe they're
saying.
all in uh transported to South Florida then, in Georgia. Eh?
Yeah, yeah, they're actually migrant dogs
Hey kids, want
from
to go to Florida
from
and go see Fluffy?
these are migrant dogs from Guatemala. So they're shipping the dogs back to Guatemala. That's what we got to do.
Friggin' immigrant dogs,
I
as if we
I
don't
well
have enough.
I was listening to some Republican
Yeah.
the streamer the other day. I just flipped on like I was what are the what are all these like conservatives and stuff talking about in the States? And he was talking about all these dogs coming over the border or something like that. So unless he was referring to humans as dogs, which would be
Oh,
extremely horrible.
that would be. Do you think a Republican would? I can't.
Are the conservatives in the States horrible enough to dehumanize people like that? I don't know.
Well, when Donald Trump says grab him by the pussy, he means cats, right?
Yeah, I
Isn't that?
like that. Like it's key to a woman's heart, showing her that you can,
Yeah.
handle an angry cat. Yeah,
I took my cat to the vet today.
I hope that
Ju-
went well.
yeah. $338.
Oof.
I know. I usually go to small town Alberta because you get it for $80 and three vaccinations, an exam, and $338. And I thought to myself, you know what? The vets need the money more than I do, right?
I mean,
That was my impression.
have you
And
seen your
but
vet's? Have you seen your vet's house though?
yeah, that's true. They live out of town in a place I can't afford to live, probably.
I mean, all vets aren't. Not every vet's in the same situation. I've known
No.
some very working class vets,
Oh
and
yes,
do know
yeah,
actually.
that's true. Especially small town vets. That's the secret. You go to
Mm-hmm.
a small town and you can get your vaccinations, everything, $20,
Yeah.
right? Speaking of which, as far as vets go, how's your vet? How are you? Sorry, that's a bad segue. My bad. How's your health been, Davey? How you doing? Can I
I'm,
ask?
uh, I feel like $20, man.
20
Uh,
bucks. Canadian or American, right?
it doesn't matter, man. Like 20 bucks is the new $5 as it is. So,
Uh, a hun is the new 20. Yeah.
but I'm doing okay. I'm doing better.
Good. We were
Getting a little bit more
talking.
mobile, but
Good.
yeah.
I'm glad, and especially I'm glad. I want nothing but the best for you, Dave. In my opinion, you're
Hmm.
you're a heck of a guy, and your voice should be heard more in the world.
That's kind of you.
Not when I'm sleeping, though. I mean,
No,
just
you're sleeping.
yeah, we'll save that. So I've also been having
Mhm.
health issues, and primarily we were talking about off air was because I had a 2-year wait for an operation, and now they've extended it to 3 years. My GP has recommended I get a second opinion. I was right on that. And March 4th, I can go in for a second opinion, and hopefully with a specialist who doesn't have as much of a wait list as my current specialist. But I got to thinking, I don't know what you think about this. What if the first guy is the best guy? That's why he has a wait list.
I will. Ooh. Oh, wait,
Yeah.
is it a wait list to get surgery with that guy? because sometimes it's just like in the observing surgeon. I've had four
Yeah.
kids, and like there's like, yeah, this is like your doctor who's like allegedly gonna deliver the baby, and that doctor is never there. You know what I mean? I
Right.
remember, I've gone in for surgery, and like I have a doctor, and they're like, oh yeah, your doctor, and it's like they put me out. I see no doctor,
You're right.
so
All you
they're gonna
know
put
is
you out.
your
You don't know if that
underwear's
doctor's gonna be there. Like
your underwear is gone. You got a smile on your face. That's all you know at the end.
I think it's a bigger like kind of provincial wait list. I don't know, like with some specialists, yeah, you might have like a handful of specialists in your area, but it's usually like the guy who's like,
Mhm.
these doctors are so bureaucratic these days. Like,
Well, you know the letters you get. You probably got a few letters, but I have had a letter. He himself will call you on February the 9th between 2 and 4.
huh.
He himself will go over. He himself, who talks like that, right? Now, if we were in Britain, I would say, yeah, he himself would be King Chuck, would be calling me on February the 9th. But yeah, it's like I have considered a private
Yeah.
surgeries. How do you think the privatization of services in Canada is more and more now? There are
Oh,
people out
absolutely.
there. Yeah.
Absolutely. Absolutely. A lot of this started with Quebec because
Oh yeah. Always Quebec.
Quebec
Friggin'
was
Quebec.
doing it, right?
Yeah.
Because they're like, we're Quebec, we can do this kind of thing.
Yeah.
There was a constitutional challenge, and Quebec came out winning. Um, if I remember correct, I could be completely off
It's
base
it's
on
like
that.
Quebec doesn't want to be part of the country. They're so
It depends what part of Quebec you're in, right? It also depends how the economy is doing.
right.
Depending on the economy and what part of what part of the country you're in. Things could be very different. I'm in a big anglophone, liberal kind of NDP stronghold in Western Quebec,
Right.
like right on the border with Ontario, with Ottawa, with the nation's capital. We have a lot of public service workers here.
Right.
There's no overbearing demand for separatism in the area that I'm in, for
It's for
example.
good health care and good beer.
It's like
That's
in
good.
if you're like in Montreal as well, downtown Montreal, this is not a very big area for separatism, except for some
Yeah.
uh, of the leftist like left wing like kind of
How about super left?
national liberation kind of
National.
ideas of
Yeah.
Quebec, which that's not that's like maybe 20% of the separatism in Quebec. The other
Okay.
60% is a lot more right wing for the most
Right.
part, actually. But yeah,
Well,
sorry, I'm
it,
detracting here
no, no,
from our
no, that's fine.
conversation.
It's a good conversation. Charity and Cameron on their walk across Canada for murdered and missing Indigenous. They were told in northern Quebec, do not walk, get in your truck, drive across.
Yeah,
That was the RCMP or Quebec Solid. I forget what Quebec. The
the
police in
sur-
Quebec said, yeah, the
the Sûreté de Quebec. Yeah,
Sûreté du Quebec. That's correct.
yeah,
Yeah.
yeah.
Bienvenue,
That's
everybody.
the Quebec provincial police. Yeah,
And they were told to just drive across, get to the other side.
yeah.
And you remember the Winnipeg landfill story, which is still
Oh yeah,
ongoing. Yeah,
yeah.
murdered and missing Indigenous in there. And
Yeah, Wob Canoe said they're gonna do it. They're gonna do it
the,
eventually.
yeah, and they get to the end of the country. At the end of the country, Cameron says, "You know what's there, Walter?" I said, "What?" He says, "The garbage dump." At the end of their walk, they found a garbage dump. It's not poetic justice by any means. It's
No.
just somebody with a cruel sense of humor almost
Hmm.
on that. But I digress. We were talking about a little bit about healthcare and about the privatization of Canadian healthcare. Now,
Yeah.
this has been an ongoing impact for years in Canada, about especially in Alberta. They've tried Quebec. Quebec has won the right to have private surgeons, I guess. And here in Alberta, they're most certainly trying. They've again taken away our health board, and they're going to retool it And somebody else is going to make a lot of money, in my opinion, and not help us poor guys who are Albertans. And grift and graft and greed. The 3 Gs.
I like from what I can see, there's no demonstrable proof that it can really improve like health outcomes. I think like
I'm very
it's
tempted to do it though, instead of waiting 3 years.
If you can afford it, you're bumping yourself up on the list.
Or even these vacations we were talking about, medical vacations. I mean, who doesn't want to go to Colorado on a or Spokane? Hey, Spokane, man. They have a junior team there, so the Chiefs junior hockey team.
But yeah, like it's hard to say like, hey, like when I was having a health emergency with my cancer a couple years ago at this point, I'd say.
Yeah.
At least by the time when I was like actively trying to get a diagnosis.
May I say you have nice hair nowadays?
I do have nice hair now. It's not even. I had
bestest hair.
I had it cut a couple times. It's not even curly anymore.
And they're not David Feldman hair plugs at all either, right?
They're not. They're not.
No.
It's not.
All natural.
This hairline isn't as perfect as it used to be, but I guess it's still acceptable.
Darn.
I'm not gonna actually complain about my hairline. I'm good.
Yeah.
But
sorry, I got you off topic. It was just the hair. The hair looks so friggin' good.
It's easy to do.
As an older man, I notice these things. When I meet my friends, the first thing is we look at the hairline, then we look at the belly.
Yep.
So go. I'm sorry, Dave. You go ahead.
But,
we talk
hairline and a belly. I got both. But yeah, no, like
his hairline stretches up to the belly.
I was looking for like I was looking for a diagnosis. Once I had my diagnosis, I was fine within the publicly funded system.
Right.
That's the thing.
The diagnosis
for on my end for what the issue that I was having, it was the diagnostic process that was I was able to at a certain point drop my pants in front of my doctor and be like, hey man, help me out, what's going on here? And he's like, oh okay, yeah, we're gonna put in a work request. But one thing my doctor did tell me, he's like, hey man, do you have like insurance? Do you or your spouse have insurance through your employer? Because if so, or if you can afford it otherwise, if you have the money to do it, get this checked out.
Stop.
Like get it checked out at a private clinic, because the wait time can be a long time. And I was looking at 9 months, a 9-month wait time for an ultrasound.
Mm-hmm.
So I went
9 months for an ultrasound on something that is very, very should be checked like now.
Mm-hmm. So I'm like, okay, 9 months for my ultrasound. I finally I get an ultrasound through the private through a private clinic. My results come back inconclusive.
Right.
So in this time I finally get the results after a couple weeks from this clinic. I pass it. It's sent to my doctor as well. I meet with my doctor again, and they're like, okay, so it's inconclusive. This is after about a month after my ultrasound. I find out it's inconclusive. He's like, we're sending you to we're going to send you back for like a CT scan. So we're going to scan your body, and we'll get a better result this way.
Why that should be a song. Scan your body.
But like,
I know someone from the Pussycat Dolls who might be able to make that song.
Even through the private system, I now have to wait like another month just to get an appointment. I get my appointment.
Yes.
They do the scan. They're like, this is bad. I finally have a urologist.
Right.
And then I wait another month on having to get surgery. I recover from surgery for a month. I'm back at work. I finally get results. And about a few weeks later, I'm in chemotherapy, right? And
Few weeks after your diagnosis,
so
because
so so so
they
so
said
this whole process, yeah, to like
right,
for me, for my doctor telling me I should go private if I can,
right.
and me finally ending up in chemotherapy. This process, even through the private system, takes me about 9 months.
Wow.
Okay. As I'm sitting to go into chemotherapy for my first day ever, I'm there with my wife, and my phone rings.
Hmm.
And they're like, "Hello, sir. We'd like to schedule you for an ultrasound." This was the public system calling me, telling
Wow.
me, "Hey, we can finally do the ultrasound on you." The ultrasound, that I ended up doing through the private system, which ended up coming back inconclusive. That was 1 month into. If I had to go another 9 months of either trying to get into navigating the private system after finally getting that ultrasound or whatever, I'd probably be dead.
That's. I think
Right?
you'd be dead, Davy.
I'd be dead
Hmm.
because my diagnosis was already stage 3 cancer, which had spread to my lungs and to my
Oh,
lymph nodes. Right?
son of a.
That was my diagnosis. I already had stage 3 cancer, so I was getting hit with extremely aggressive chemotherapy.
Wow.
So if I had to wait another 9, 10 months on that
Right.
for a diagnosis through the public system, I may not have made it. And the thing is that this is how like like just messed up, like how backlogged our public system is that people are dying waiting on treatment.
Mhm.
That's the problem. Yes, there is this public option available, but there has to be another option than just putting people into medical debt, right? Like this used to work.
This
This
used to
used to
work.
work.
Yes.
This used to work.
Yes.
Something
In,
happened where we stopped funding it as aggressively, where we stopped managing it as aggressively. Um, as people, as governments have slowly just like tried to make cuts here and there so they can look better for election years.
that's.
There's a fundamental problem with how we organize our healthcare that has allowed it to get this bad.
Well,
Because honestly, if you look at healthcare outcomes, like beds per capita, etc., like most kinds of healthcare outcomes in Canada versus the United States versus the states, it's about the same
yes.
for our healthcare outcomes and for our healthcare access.
Well, part of
Um,
what you went through is you're supposed to be triaged, and then go up the list. That's how our
yeah,
public system works.
exactly. Yeah,
You couldn't get the diagnosis
I
to
couldn't
get
get
into
the
triage.
I exactly. Once I had my diagnosis, I was great.
Yeah.
I had people left, right, and center coming at me.
Hmm. Can I ask? I've got some more questions on that, but
Yeah.
your chemotherapy, did that get? Because you said it spread to your lungs too as well, or
Huh?
had a chance to?
Oh, it had spread to my lungs. Yeah.
Did that chemo work for you? Is this
Um. Yeah. I'm what a year out of my last chemotherapy session. Over a
right?
year out of my last chemotherapy session.
Okay.
My last chemotherapy session was like January 1st, 2023, or something like that.
Okay.
And I've been clear
It,
ever since. I've had
well,
like
that's
I said,
awesome.
they actually care about me now.
Right.
So I like, I've had regular checkups with an oncologist, the different scans, regular scans and blood
Right.
tests. So I'm doing regular CT scans to check for any tumors coming back.
Any
I've
remission? Yeah.
regular blood tests
Right.
like every few months. I have to do a blood test soon because I have an appointment coming up next month, and
Okay.
I have to go for one of my CT scans on Monday.
Oh, wow.
Um,
So there's mobile CT scans in Saskatchewan.
Oh, that's not. I mean,
You know, they go to small towns and they do it. We don't. It's quite the wait list up here in a major center to get into CT and sometimes ultrasound too. But I would be remiss to say, on behalf of Canada, I'm glad you're doing good because we would miss you. We would all miss you. And since I'm older, I need to go first before you, Dave.
okay.
Okay. Can't
We'll
kill
see.
Superman.
We'll see. We'll see. We'll see how it goes.
But you know,
We both got a lot of time left.
you touched on something there. The public system used to work here in this
Mhm.
country, right? Now we're stressed, some say from immigration, which I do see when I go into the hospital emergency room or into doctor's offices. They're stressed out too. There's so many more people. Is one
Mhm.
tenant. The other tenant, and I'm going to say primarily from my Alberta experience and possibly from Ontario, is the fact that we have the push from the American-styled medical professionals to go private, right? And our government's been slapped a couple of times by the feds, rightly so,
Mhm.
for trying to do that. However, there does reach a point where if it costs an extra $20 or $40, you will go to see a private person. If there was a private CT lab set up and you could pay $60, they would be, or $100, probably
It's
more.
more than that.
I know it is. I'm just doing something nominal. They
Yeah.
would, they would, they would be busy 24/7. And a lot of
Yeah,
times too, the
absolutely.
CT scans in the hospitals, they weren't working at night, only
Hmm.
for emergency people, right?
Yep.
So we weren't utilizing everything. Um, Doctors and nurses shortage. Do you find that in Quebec?
Absolutely.
Yeah.
But like we have a really good training program, and wages are not competitive with the United States. So
Right.
many people go down to the United States to work. My grandmother was one of these people. She did her training
Mm-hmm.
with a group of nuns in northern Manitoba.
Mm-hmm.
Worked in Manitoba. She worked in, I think she worked out west a bit. She worked in Ontario for a good long while, and she finally moved down to Texas because she could make really good money working in Texas. And she did that all through the '90s,
Wow.
and yeah, had her
My
green card
cousin.
and everything. And like she left the country just because she could buy a nice house and like live a good life by being a nurse
Mm,
in Texas, which is something that she could not do
in
by
Quebec.
staying in Toronto or staying in Manitoba.
Wow. My cousin was a registered nurse in Texas and Hawaii, and they said the staff there really ran the nurses ragged. Like it was a
Hmm.
lot of work, maybe more than should be, but the money was good, is what she said. So
Hmm.
friggin' Americans and their money, eh? You
Hey,
know,
they got a ton of
taking
it.
our people.
Hmm.
You know, I remember when the CFL football league paid more for bringing Americans up than the NFL paid the Americans, and that's most certainly has switched. That would have been the late '60s, early '70s. So we used to bring up their superstars out here. Um, America gets to keep them now because they have the money. Um, we have a good system, like you say. I just want to get back onto that. The public system used to work. It used to work like gangbusters. And now the doctors don't make house calls or anything. When I was a kid, they did. Can we? How do you feel about lessening the education for immigrant doctors coming over?
I,
I believe they should still have Canadian styled education for the medical.
I think a lot of the time it's not really a question of lessening the education. It's more getting some doctors more in line with uh the style of care,
Right,
because there is a different expected style of care and how their approach is,
right.
how the model works, what you are and what you aren't allowed to prescribe, how you are allowed to prescribe, and things like this. I
Right.
think I think the basic science of medicine stays the same, right? It's very little things most of the time. Sometimes terminology, acronyms,
Right.
slightly
Which is
different things like
important
that,
in the
which
medical
is important. Yeah,
establishment,
yeah.
right?
Depending what you're doing, especially if you're some sort of specialist or something like that. But I think this really comes down to just like I'm not going to say like
Right.
doctors need to be paid more. Doctors make a lot of money as it is, but I think what we really need to see is, like you said, the doctor making the house call. Like that was like a doctor that was in the community.
Yes.
And I think if we look at like the Quebec, the old Quebec model, I mean, we still have them, the CLSCs, which are basically like uh, public, almost neighborhood clinics.
Hmm.
Uh, so basically, every community would have a CLSC in them, which is like a small clinic where there'd be
Yeah.
some doctors and nurses working. We still have them.
We have
Um,
those. So we call them Medicare,
yeah,
Meta something. But yeah, we have
but
those
they're like, yeah, these
around.
small private government run
Right.
clinics. Though they're super underfunded now in Quebec.
Oh,
We don't have them. We still have them. They're usually not been building a lot of new ones,
right.
and they're not staffed all the time. But if
Hmm.
we actually had doctors in the community, doctors and nurses in the community who are
Right.
able to help people out, if you could just like get off the bus and like go like see a doctor, right? You like have like I mean, we do have doctors working in these places in the community. It's just not enough. We need more of them.
Right.
But we need to really get these people into the communities to be doing preventative medicine, right?
That's it right there. Prevention is a pound of salt right
Hmm.
there.
Exactly.
Yeah.
Because
No, I agree. Your diagnosis should have been no problem to get that diagnosis
yeah,
and get you into treatment. Uh, as far as what I have too, like if I have to wait 3 years, I'll be a very old man. And will my
yeah, no,
body go through the surgery then? Depends how I
well,
take
yeah,
care of
and
myself,
if
obviously.
you're
But
not doing well, you're just going to deteriorate in that
yes,
time,
yeah,
right?
I watched my
It's
mom and dad both deteriorate over stuff, and then
yeah,
yeah, next thing you know, they're in a wheelchair, right? So
this is
wearing
not
a
what we
diaper.
want for
So
this is not what we want for people who can still be
no,
productive members of society and still
that's
have
right,
so much to give to society. Like
right.
you're not even, are you even 60 yet, Walter? You're not even 60 yet, are
Oh
you?
yeah, bless you, my friend. No, I'm over 60, so
Okay.
I'm glad.
Like just over
I play
60.
like I'm younger.
But like but like, yeah, you see, like you're so passionate about like the work that you're doing, and you're still like going up and doing
Yeah,
work. It's like, Jesus Christ.
yeah,
Like
you know,
and this is one thing I saw in the one thing I saw in the United States was a lot of people working injured. That's one thing
yes,
I saw. And that's
yes,
one thing I don't want to see like up here, because that's where we're headed.
right.
Is like, because like, man, in the United States, like, man, like I might still have to be working, even though
Well,
like I'm not good, and I'd be hurting myself even more.
you got that
And
right. There is a class of worker though that is underinsured through the company standards, and there are some people who would rather go to work than go to get a medical note and stuff.
yeah,
The way some of these companies are being run, but if you're in a middle, I don't know, a bigger company, usually they have to follow all the guidelines, which is strange. You'd figure all of them should, and if you're sick, you're sick. But especially for a medical note, if you have a cold, do you really need a medical note for work? And if you have a cold for 3 days, do you got to see your doctor for 3 days in a row to get that note? Um, I know the states is challenged with that right now. You either have a job or you don't. Is the basic mentality. Uh, there, it's survival of the fittest almost. And how can you be fit when you're broken?
yep.
You know. So I will paraphrase that slogan and copyright that. I think that would be good. So we're not doing any electioneering yet, right? As far as you can
Not
see.
yet, not
Not
yet.
yet? Oh,
You
geez.
can get
Okay,
into
good.
it.
You know, that troubles me sometimes. Electioneering. You get flagged for it. You never know. You never know when you're going to get flagged for electioneering.
What have
Um,
you done?
The these medical voyeurs that go. A friend of mine's in Vietnam right now, and I think he spent $2,000 to $3,000. He had 16 teeth done, veneers, and including crowns, and $3,000. He said that that paid for his trip.
Yeah.
And up here it would have been $15,000, maybe 20,000.
Yeah.
In Alberta, the dentist rate it's very expensive. Alberta has one of the highest wages for dentists in the country,
Well, I'm sure.
and
I'm sure they do, making money off the oil industry.
well, yeah, I guess so. Pretty soon there won't be no oil industry, Dave. If
Oh
you've
well.
heard the news lately, uh,
Yeah.
we're going to all be electric.
It's the funniest
There's,
thing.
yeah.
In
Um,
Canada, no, it's not going to
right.
happen.
So the NDP has, I see, forced the Liberals to come out with the pharmacology. No, it's the
The
dentist program.
pharmacare. Oh, yeah. There's a
First,
dentist
the
one they've already come
dentist,
out with. Yeah.
right? And I was reading that if you're over 70 and under
Under
16 or
20
something,
or
you can have,
yeah.
yeah, it's something like that. Old people and kids, and then towards the end of the year, the rest of us will be able to be in there. I wonder how that's going to work because it's on a sliding scale. First off, they have to know it must be you pay it up front and then you get a rebate because it's saying for people between a certain
Exactly.
salary. And the only ones who are going to know that is the government at tax time,
Yeah.
right?
That's the only way they can do it. So yeah, it is a rebate. You have to send in your receipts.
So you're still basically out of pocket for poor people, or I'm
Yeah.
thinking the people who
Which
are
which, which means
homeless.
which means that the poor people aren't going to take advantage of it because
No,
they aren't going to have like $400 sitting around to go get a filling. Right.
that's right. That's right.
Like it doesn't actually help anybody
Please,
unless
sir, here's my pamphlet. Mr. Trudeau said
yeah.
I can have free health care. See,
Yeah.
and no dentist will take him up on that.
Yeah, at least with pharmacare, a lot of provinces already have
Mm-hmm.
their own kind of pharmacare plan to an extent. I know in Quebec we do. So with the extension of with the beginnings of pharmacare that they're talking about doing, it's what are they talking about? It's going to be birth control.
Mm-hmm.
It's going to be insulin and a couple other things.
Well,
That's
insulin will go a long way.
I believe so. That's what it's in the talks. No official announcements or plans yet or anything passed in Parliament.
So for
This,
the
but
pharmacare plan, just to let viewers at home know, is Jagmeet Singh of the NDP has told Trudeau, "You're going to pass this, or we're taking away our right to uphold your party in Parliament," which could trigger an election if they do that. If they have a vote
oh yeah,
and the NDP don't go along with it, we could be faced with an election. Oh,
which
all right.
Trudeau
We're
will
not
not win.
electioneering. I'm just pointing things out. Okay, I
Yeah,
just want to let the YouTube
Trudeau would
guys know.
not win that election. By the way, all that's
Totally
what
electioneering.
according to the polls.
Right. What did you say, Rick? Is this electioneering?
Totally electioneering. I wish you would stop.
We're electioneering. Well, no, we're just pointing out the facts, I think, right? And
Yeah.
YouTube monitors have a little faith. We're not talking about who's going to win. We're just talking about who's going to lose.
One of my most favorite things would be seeing Pierre Poilievre with a minority government, though.
Ooh,
Nothing would give me more pleasure to see him squirm as a minority leader.
I would like to see him squirm, I have to admit. And again, not electioneering. I would just like
Not
to see that.
electioneering.
Just much like his wife likes to see him squirm.
It's a fetish. Yeah. Wait,
Electioneering.
my wife or Pierre's?
Pierre's.
Yee.
I have to
Mamma
say
mia.
he's really done the makeover though with the I hope he goes for LASIK surgery down the road so he doesn't
Yeah.
need glasses. So
Yeah.
then he could get Drew Carey glasses where there's no lenses in them if he wants to look important.
Yeah, and he's wearing the what's that thing that you wear under your? He's got the
Oh,
Spanx on. He's got the
yeah.
Spanx.
I'm wearing one right now, Dave.
Get rid of his love handles.
Well,
We can tell.
that's true. Do you see do we have a political way forward for healthcare? Do you see us coming together to fix this thing, or are we going to just let it drop? Or you're not sure?
I think the only way that we're going to improve our healthcare right
Yes.
now, honestly,
Hmm.
honestly,
Yes. Tell me.
our
Tell
our
me,
best
Dave.
our best bet to fix it is for the Americans to get a better system than us. That's the
Ooh.
only, at this point, that's the only way that we're going to be able to justify it.
Well, they should go Swiss model then, I think.
No,
I mean, even
but
Russia's got healthcare and America doesn't. I mean, what does that tell you? I'm not saying it's the best healthcare, but did Jordan Peterson
the
went there and
the
got his
the,
affliction done with, right?
The United States spends more per capita on healthcare than we do.
Yes.
They spend more on their healthcare than we do.
But the results
Um,
are so better for that 1%.
I mean, there's a way forward. There just needs to be the political will,
Right.
and if we can compare ourselves to the United States and say, "Ha ha ha," it's still better.
Right.
Until we can stop saying that, our healthcare will be in decline. In my
I
opinion.
totally agree with what you're saying there. If America, listen up, America, if you had a better
No.
healthcare system than Canada,
Mhm.
we wouldn't be so troubled up here in Canada because we care about our American brethren,
Yeah, yeah. We need
right?
to compete with you.
We do. You know, our brothers and sisters in the deep south, and some of them are related to each other.
You
It's
know,
fine.
where the dogs run wild on the highway.
Dogs run wild. The COVID dogs, the one it was pet and release. What that was. Where's my dog in Florida? Living the life of Riley. You bring up a good point right there. And America, I mean, they're like when we were going to the Medicare system, like even Ronald Reagan came up and was doing advertising in Saskatchewan. Don't do this. Don't do this. Right? Do you want the communist healthcare system or do you want a good one? And well, we opted for the socialized medicine, which has helped us through the years. Canadians live a little bit longer. They're a little bit taller, and I think that's nutrition plus pharmaceutical help, right? Some of our friends in the States with diabetes, they had to do put their insulin shots to half so they can spread out because they didn't have enough
Mhm.
money, which is a BS thing to do for a country to do to its people.
Absolutely.
Out of the politicians running in the American election, I don't really see anybody pushing that idea forward. Um, so maybe when you're my age, Dave, America will have health care.
If it's still there, man. If it's still there.
Well, that's true. Even Mexico has health care of some sort, right? So
I believe so.
yeah, we were talking to Rodrigo, and yeah, as long as you got ID, you can get health care. But the trope about going to the emergency. So I was in terrible pain. I went to the emergency, and I'm looking at everybody there. And it would have been between 12 and 14 hours for me to see a doctor.
Yeah.
Meanwhile, you're in pain and your blood pressure goes up. You're just in terrible pain, right?
And you're
I
likely to
eventually,
catch something while you're sitting there, right?
well, this is true. It's true. And there was no animals to pet there at the emergency because they all went to Florida, so you didn't have those
Yeah.
those care animals. And so I eventually went home after a couple hours because I thought I could lay in bed or I could sit in an uncomfortable chair. So, and then I tried to get to my doctors and my specialists, so I didn't use the
Yeah.
emergency program. Then it was so difficult to get through to go see them because they're all busy and they all have a schedule to keep. And but I ended up getting past that particular emergency. But
Thank goodness.
I feel, well, the people in northern BC right now, since the Greyhounds pulled out, Greyhound used to take the people into the major centers for their checkups.
Yeah, and in Manitoba there was that one rail line that they had to shut down as well. Something similar situation. Yeah.
Yeah.
We got an American style train system too, man.
And so now we have it where people in the northern communities are having a tough time scheduling for appointments, and God forbid if they had an emergency up there, because there's not a lot of doctors or nurses up in these communities to handle it. We're having a hard time getting people out in a small town, rural Canada to become doctors. However, Alberta did come up with a program would they would pay extra if person was there for a year to 3 years. So hopefully that helps.
Thank you, Danielle Smith.
Yeah.
Is that her or was that the
Yeah,
previous
yeah,
one?
yeah. No, the wheels keep rolling on that bus. That's for sure. So do you see any other way forward, or are we all going to move to Europe, or
Oh,
what's the
goodness.
scoop here, man?
Who knows?
Yeah.
When's our next election year? This is big in the news here right now because there is talk of Justin Trudeau stepping down. I've heard there's talk of this with this big push for the pharmacare
Right.
that we might the NDP might be triggering an election. So I think healthcare is. I think we're going to talk about it a lot.
Okay.
I think we're going to talk about it a lot, and I think we're going to see a lot of promises. But I don't know if there's going to if there is going to be any real path forward. What I see is a lot more private in the future of Canadians, and I don't think we should get used to it. I think we should fight it, and I think we should. Yeah.
I agree.
I'm not going to say exactly what I think because sometimes I go a little bit too far, and I know we are live on YouTube right now.
Yeah. Well,
I don't want you. I don't want to get you flagged for anything worse than electioneering. Especially
what do you mean I'm not flagged for electioneering? Come
especially after I was up here the last time I was up here, and I think I was said a couple bad words.
Well, a couple of short words coming from you is better than an insult from my wife. So we'll say that. Does anybody have any questions for Dave on Medicare or on the health industry, or do you have a comment about the American system?
I tend to agree with Dave on his assessment that until America gets its program together, that Canada will continue to lose the coverage that they so desperately clung to since the second national healthcare system. But unfortunately, while he's totally right about that assessment, it won't mean anything because the United States will almost assuredly never go to any kind of Medicare for all system ever. That's my comment.
And that's based on your being around as an American. Yes.
I live in America, and I know the attitude around here. And the last thing we're going to do is start giving undeserving stuff they never earned.
Yeah.
Okay, put the gun down.
Nope.
Put it on the floor. Kick it over here.
Listen here, Canada.
I mean, isn't that just a shame that you can't have hope that you can have a national health system?
That hope died with the Bernie Sanders campaign. So,
right. Yeah. We're not electioneering here. Once again, we're just mentioning names.
You know what I do want to ask, like, why you guys have been you've completely ignored Trump's Medicare for All program, and I don't understand. Well, it's like
because I don't understand Trump's Medicare program. Do you?
Yeah, it's a Bernie Sanders style Medicare for All program. He's been talking about it for years.
I think if he would bring it in, he might be president.
I'm just kidding. not have any sort of, like, he doesn't,
Right.
he's never even heard of it.
Right. And this program does not electioneer for any candidate. I just want to make that clear.
It would be
No.
really fun. It would be really funny if like Trump came out swinging against Biden with public health care.
No.
That would be amazing.
That would
Public
be
health
amazing.
care and amnesty.
Amnesty.
Liberals would blow up. Their brains would stop working. They wouldn't be able to comprehend.
If
It'd
I
be
could,
incredible.
if I could see that day where Trump came in with Medicare, you know,
I
that would be
mean,
cool. Their
everyone
heads
says
would explode. Yes.
everyone says that Trump is a fascist. Everyone says that which would, I'd assume would mean that he's a corporatist. With the European style of corporate state, that
Mhm.
was popular in Germany at the time, and Italy, and a lot of like post-war Europe. We saw the corporate states, Belgium, for example.
Mhm.
Like if
Frickin' Belgium.
if he came in with that real like fascist healthcare, which I mean, it's for the Volk, for the people, for the chosen people, that healthcare for the great American people. I mean, he'd blow up the liberal brain.
It would. Fascist healthcare. I think
If
that
he
is
was
such a
really,
nice tagline.
if Trump was a real fascist, if he was actually a fascist, he'd be campaigning on public health care.
Volks healthcare.
Volks healthcare.
Yeah.
It's time for a new Autobahn too.
Volkscare. Yeah.
Why is the I-99 kaput? I don't even know what that is. I mean, you talk to an American and they tell you which road to take.
Yeah. Also, why are there potholes on the highway in the United States? This is I want to know. This is I'm from Quebec.
Well, there
roads are
wasn't
bad.
until
Keep it exciting.
There was none until 9/11.
Is Osama bin Laden's fault?
Yeah.
We're saving money, Davey. We are saving money. Listen. My state, Indiana, had a $2 billion surplus, just sitting waiting to be used until the pandemic came along. Imagine if we used some of that money. Where would our surplus be? Roads? We don't need roads.
Where we're going, we don't
We've
need
got
it.
we've got tenacity of character. It's about the kids, Davey. It's about your children.
I mean, I heard about like the American infrastructure falling apart. I just it really was bewildering to me. Where I'm like, oh, I'm gonna break my car if I go 10 over on the highway.
Well, the thrill keeps you awake on long drives. I don't see the issue.
Yeah. When you've worked 3/12s in a row at a hospital, or maybe 16 hours, who knows? Sometimes they pay you a lot of money for being a crazy weirdo. And really compromising the amount of care you're able to give somebody, by the way. Because you haven't eaten in at least 8 of those 16 hours. It just
you gotta have a
it
puppy
makes you
roast.
feel alive. You can't really know what it's like. I feel like I'm doing a fucking Feldman bit right now, man.
No,
Wolfie, when you have a
so
Canadian
definitely
on, their time is very valuable, so you have to get to the point. Go ahead.
Oh, well, the point is that we're full of crap. And the American medical system here is set on artificial scarcity because we make it impossible to become a doctor without going well into debt or getting involved in our broken education system. Heavily.
Not much different here. Like doctors take on an incredible amount of student debt here as well, but yeah, not maybe to the level of as in the United States, but it's still significant.
And
but they're Canadian dollars, so it's like even funny money you get.
We also have lower wages, so it takes it takes them longer to pay off. But yes.
Well, if it weren't for the insurance
companies, all the
companies,
same,
they would still not be getting paid what they're paid today.
Mm-hmm.
because all of that's where the inflation on the American side comes from, is the a massive amount of money that the insurance companies are able to charge and pay out for the care. And beyond like just the debt and being able to take on that debt, they also gate the education beyond that. Like, furthermore, you're gated out, and then you also get shunted into whatever your practice ends up being.
Yeah.
A lot of doctors don't get to choose what they get to do. They don't get to choose if it's emergency medicine or not. And then you're part of an organization. Like, all the doctors that worked at all the different hospitals I worked at don't actually work for the hospital. They're like rented for a fee from an organization that works for the hospital.
It's actually not too different from the Canadian system in that regard either. We just have.
You mean the American system that you guys are adopting?
Well, we still have an extremely corporate system that is managed by corporate boards, both at the hospital level and at the regional health authority level.
Friggin' death panels.
Canadian healthcare is not it's extremely neoliberalized, which I think a lot of people don't understand. Like a lot of what you were saying is extremely reflective of the Canadian healthcare system as well.
Yeah, I've discussed with you before about this, and I was surprised that some of the revelations you told me about the system. I still think you'd probably rather have your system than our system, but that's the best I can say.
Yeah, no, and I think a lot of that misinformation comes from Canadians themselves, because we are propagandized by our own government to a certain extent to think that our healthcare system is significantly better than the United States healthcare system, and that it's very different from the US healthcare system, when it's really not. It's just nominally better, just at like, the point of payment.
That's the one thing that you probably don't have, is like when you first go into a clinic, the billing office is the first thing you see.
Yeah.
We also love to make fun of anything you guys do. Like, I pick a thing.
It's not even a real country anyways.
Hey, Rick, I got a question for you. What's a billing office in a hospital?
Well, like, when you go to the TGI Fridays and there's that lady who seats you and she sometimes takes your money, it's like that for your doctor.
No, we get free food up here too, so I don't know what you're talking about.
We have billing offices at our hospitals as well, at least in Quebec.
Right.
No, from what I understand, it definitely sounds like you guys you're not just fully escaping.
We're losing you, Rick. Can you get closer to your microphone? Sorry.
Well, I just wanted to say, like, it's not like a British system. I understand that, but like, yeah, when I go into the clinic, the first person I see is the person asking me for my credit card.
Yeah.
Well, that's a shame.
Yeah. There are unique challenges in the Canadian system as well, like trying to access care in another province, for example. Like, let's say I'm in Quebec and I go over to Ontario. It's more difficult for me to get service unless it's like emergency service, right? Like, I come in on a stretcher, right?
Is that because you talk French, Davey, and you can't find anybody to talk French at the hospital?
Exactly. You can tell by my outrageous French accent.
Yeah.
Right. But so like, yeah, no, like if you travel to another province and you get sick there, it's very hard to get care, and
it's true.
At that point, you have to pay at the point of service as well, right? Mm-hmm. Because stuff is managed provincially. So if I go to a different province and I break my leg, I'm going to have to pay for it, right?
Would you be recompensated in your province later on, or no?
Yes, but maybe not to the full amount.
Right, to the amount that province would charge.
Exactly.
To fix a broken leg, right?
That doesn't sound very Canadian.
Well, your best bet there is to say, okay, thanks for the bill. I'll get back to you. And then hopefully your province pays for it, so it's not out of pocket.
But you're in listening to Davey's description of his cancer treatment, it honestly, it gave me little hope that Canada was any better than America.
I mean, that was at a time when we were extremely backlogged from the pandemic. Like it hasn't gotten much better, but I think it has gotten a little bit better. I mean, I'm talking to Walter about the stuff he's dealing with, though. I'm not entirely convinced that it's gotten better fully, but yeah. I mean, we're also in different provinces that are managed completely differently. It's not like there's like one way of managing it for everybody.
Right.
Yeah, the U.S. has a similar state by state system of managing various public health care coverages.
That's true. I will say there's a lot of pharmacies opening up in my area. Like every time I see an empty building, new pharmacy going in, which I have no idea. It must be a lot of money in pharmaceuticals.
Well, have you seen what Ontario's doing?
No, I don't. What? You can
Oh.
get it at Staples now? Get your prescription filled at Staples?
Basically, well, they're offloading a lot of services and a lot of healthcare to what's the big drugstore that Loblaws owns? I want to say Pharmaprix. That's what it is in French.
Shoppers?
Shoppers Drug Mart. So Shoppers Drug Mart has basically become like the main location for a lot of Ontario health services.
Wow.
I thought it was Canada Tire.
No, that's
okay. I'm good with that. That's a sweet joke.
Unless you're in Quebec, and then it's Acadian Tire.
Acadian.
Oh, damn it!
I gotta go down to Canadian Tire get my shot. Yeah.
But that's basically what it is. Because and Loblaws is like that's the company that Pete Buttigieg helped fix bread prices at.
Bread prices, yeah.
Yeah, if you remember the Pete Buttigieg
Mackenzie when he was with Mackenzie.
Yeah.
Mayo Pete.
Hey, look, I voted for Biden so that wouldn't happen anymore. So I don't know, like, what do you want me to do? Jesus.
All I'm saying is that's the company, the Weston family, one of the richest families in Canada. They own Loblaws, which is one of our large grocery chains. They own a number of grocery chains, and they also own one of the largest pharmacy chains in the country. So what the Ontario government is doing is offering services through these private for-profit pharmacies now.
Galen Weston was brought into Ottawa and told to cut it out with the grocery prices. I'm not sure he listened to Justin.
hey, I'm going to give you a stern email.
Yeah, we'll write a stern email to Galen Weston. Like the prices, not to drift too far from the conversation, but the prices in the grocery stores are just and the quality, like drastic prices and really poor quality.
Mm-hmm. Shrinkflation as well.
Yeah. Oh yeah. Those Oreos, they're not 905 grams, they're 780 now. Grams for my American audience. Look it up. The more you know. The more you know.
Yeah, Rick knows all about grams.
Yeah, hey, I know can I get a liter of cookies here?
No, but I'll give you a liter of fentanyl.
Oh no. Oh, which is another thing with the fentanyl. Now there's a drug out on the streets that's 25 times harder than fentanyl. And they're lacing
25 times harder than fentanyl.
25 times harder. And fentanyl.
What does that mean?
That means there's more people going to die. Is what I think that means.
Yeah.
Well, I mean, you can kill yourself with less than like a contact lenses amount of fentanyl.
Are you sure? A Canadian's pretty tough, Wolfie. You might need them more than that.
Yeah, they're pretty tough.
Oh, man.
They're pretty robust people, you know.
Yeah, I think they measure it in micrograms.
Pardon me, Rick?
I hear that you're also taller.
We are taller, but it missed my generation.
And darker and more handsome.
Yeah. And hairy, too. Lots of hair. I remember. Well, Dave, thank you very much. It's been a fascinating conversation. I really appreciate you, Dave. And I hope you and I can get together and talk about some more Canadian stuff because Lordy knows there's a lot in the news nowadays.
There certainly is.
All right. Is there anything you want to say before we stop the YouTubing?
Oh goodness. Nothing that wouldn't get me in trouble. So no.
As long as it's good trouble.
It's not.
Oh, God.
Okay, Dave. Thank you so much, my
It
friend.
was a pleasure.
You take
Cheers,
care.
guys.
Thank you very much, people.
Thank you, Davey.
Thanks, Dave.